Hello everybody, this is Carlos. In today's video, I'm gonna go over IV medication administration, reconstitution, and setting a rate. Start by checking the doctor's order and the medication administration record. Now perform your 3 checks and 10 writes of safe medication administration. In this example, our order is IFEX 100 mg IV daily. In the reconstitution instruction, we have to add 2 milliliters to the vial for a concentration of 50 milligrams per milliliter. So the dose we're going to administer is 100 milligrams, so that would be 2 milliliters after reconstitution. Start by performing hand hygiene. Remove the protective caps from the vials. Now remove air from the medication vial equivalent to the amount of fluid needed to reconstitute the medication. In our example, it's 2 milliliters of air. Now inject the air into the saline vial and pull out the same amount of fluid in exchange. In our example, we put 2 milliliters of air in, therefore we're going to remove 2 milliliters of saline out. Now, if you have been using a blunt red needle, this is the time that you're going to switch it for an injection needle. Inject the saline into the medication vial, cap your needle for reuse, and shake the vial to mix well. Now use the same needle to withdraw the required amount of medication from your doctor's order from the medication vial. Remember, you must inject air into the vial before removing medication. In our example, I will inject 2 milliliters of air so I can pull out our 2 milliliters of medication, which is equivalent to 100 milligrams as ordered by the doctor. Now clean the injection port in the IV mini bag with antiseptic. Inject the medication into the IV mini bag and mix gently. Be careful not to poke yourself or puncture the bag at this point. Now immediately attach a medication label to your bag and dispose of the needles in the Sharps yellow container. Open your secondary IV line from its container and straighten it out. Move the roller close to the chamber and close the roller. Spike the medication bag with the secondary line. Hang the medication bag on the IV pole. Squeeze the chamber to fill it to the line, but no more than half the chamber. Prime the secondary line by slowly opening the roller clamp. Once primed, clean the uppermost port of the primary line. Then connect your secondary line to this port and open the secondary line's clamp. Now I'm going to show you another method to prime your secondary line called reverse priming. In this method, you spike the secondary line, connect the secondary line to the primary line upper port, open the roller in the secondary line. Now note that in this method, we did not squeeze the chamber halfway. Now all you have to do is lower the secondary line below the primary, and the primary line will prime the secondary line backwards, hence the name reverse priming. Now you set the drip rate using the primary line roller, not the secondary line roller. Finally, label your secondary line and clean up your workstation. For your documentation, please ensure you sign the correct medication in the correct time slot in your MAR. Please keep practicing, and thank you for watching.